For the record, my name is Tanya Fernandez Anderson, the District 7 City Councilor. I am the chair of the Boston City Council Committee on Ways and Means. This hearing is being recorded. It is being live streamed at boston.gov/city-council-tv and broadcast on Xfinity Channel 8, RCN Channel 82, and Fios Channel 964. The Council's budget review process will encompass a series of public hearings beginning in April and running through June. We strongly encourage residents to take a moment to engage in this process by giving testimony for the record. You can do this in several ways. Attend one of our hearings and give public testimony. We will take public testimony at each departmental hearing and also at 2 hearings dedicated to public testimony. The full hearing schedule is on our website at boston.gov/council-budget. Our scheduled hearings dedicated to public testimony was on April 26th at 6 p.m. and the following on June 2nd at 6 p.m. You can give testimony in person here in the chamber or virtually via Zoom. For in-person testimony, please come to the chamber and sign up on the sheet near the entrance. For virtual testimony, you can sign up using our online form on our council budget review website by emailing the committee at ccc.wm@boston.gov. When you are called to testify, please state your name and affiliation and residence and limit your comments to 2 minutes to ensure that all comments and concerns can be heard. You can email your written testimony to the committee at ccc.wm@boston.gov. Submit a 2-minute video or your testimony through the form on our website. For more information on the City Council budget process and how to testify, please visit the City Council's budget website at boston.gov/council-budget. Today's hearing is on Dockets 0480020482, orders for the FY23 budget, operating budget, including annual appropriations for departmental operations for the school department and for other post-employment benefits, OPEB. Dockets 0483, orders for capital fund transfer appropriations. Dockets 0484 to 0486, orders for the capital budget, including loan orders and lease purchase agreements. Our focus area for this hearing will be Boston Public Health Commission, BPHC, Part 1, including Child, Adolescent, and Family Health, Community Initiatives, Infectious Disease. This afternoon, we will have another session with BPHC to cover homeless services, recovery services, and EMS. Our panelists for today's hearing are Dr. Bisola Ojikutu, Commissioner of Public Health, City of Boston, and Executive Director, Boston Public Health Commission. Tim Harrington, Director of Administration and Finance, BPHC. Welcome. I am joined today by my colleagues, Councilor Aaron Murphy at large, Councilor President Ed Flynn, District 2, Councilor Ruthie Louis-Jean at large, Councilor Liz Braden, District 9. Just for the format, so that you are aware, good morning. We will give you approximately 10 to 15 minutes. If you need more, 20 minutes is good, for your presentation. Then we'll go to first round of questioning. Each counselor will have 8 minutes to manage their time. I'm gonna ask counselors they not ask all their full questions in the 8 minutes. Please manage your time so that you are asking your questions and getting your answer within the 8 minutes so that it's not full questions, 8 minutes, full answer, another 10 minutes, because that would not add up to 8 minutes. So if you ask all of your questions within 8 minutes, I will only allow 2 minutes for the panelists to respond and then move on to the next counselor. I noticed that that's been a pattern, so we need to get back to timing it so that if it's an increase, if it's less people, then we'll just go to third round and you'll have more time to ask more questions. So then we'll go to public testimony, and they will have, anyone who signs up will have 2 minutes each. Then second round, same thing, 8 minutes again. And then third round, whatever the time permits, we kind of just divvy up that through between counselors and wrap up at that time. And hopefully we finish on time at 1 p.m. And now without further ado, I'll hand it over to the administration for your presentation. Welcome, and please state your name and again your title and affiliation for the record. Okay. You now have the floor.
Great. Good morning, everyone, and good morning, Chairperson Anderson. Thank you for the opportunity to testify before you today regarding the Boston Public Health Commission's FY23 budget. For the record, my name is Dr. Basilo Ojikutu. I'm the Commissioner of Public Health for the City of Boston and the Executive Director of the Boston Public Health Commission. I am joined here this morning by Tim Harrington, who is BPHC's Director of Administration and Finance. So this is supposed to work, and it's not. Oh, that's not good. I was hoping to advance the slides here. Oh. Okay, great, great. Thank you so much. So I just wanted to start by giving you a little bit of background on
sorry. Dr. Ojikutu, yes. I'm so sorry. Michelle, we actually, I don't have a copy. Do we have it online so I can? Sorry, I'm so sorry. Councilor Braden, we'll have to put you on timeout if it goes off. Thank you.
And just hit down.
Sorry, does everyone have a presentation? Are you all set? You have? Okay. I'm just waiting for it to pop up in my email. I know you sent it, Attorney Goldberg, and it got lost in all my 1,000 emails. By that, I know you sent it ahead of time. It's not coming up. Got it. Thank you. All right, we're on the same page.
Okay,
Thank
great.
you.
Thank you, Councilor Anderson. The mission of the Boston Public Health Commission as the city's health department is to protect, preserve, and promote the health and well-being of Boston's residents, particularly those who are most vulnerable. Our priority areas are on this slide. They are racial justice and health equity, workforce development, informatics and data, and collaborative partnership with surrounding communities. We carry out our mission under the supervision of a 7-member Board of Health, which is appointed by the mayor. The board is responsible for appointing BPHC's executive director, approving our budget, and has independent regulatory authority consistent with its role as a Board of Health under state law. And as you all know, the board is made up of leaders in healthcare, public health, and organized labor, and provides really valuable strategic guidance to our leadership team and staff. Just in terms of our organization, we have 6 bureaus and over 40 programs, and nearly 1,300 dedicated employees. So the focus of the presentation this morning will be on our Infectious Disease Bureau, our Community Initiatives Bureau, and our Child, Adolescent, and Family Health Bureaus. I also wanted to briefly pause to thank the Council for recognizing National Nurses Week. As you know, there are many nurses who work at the Commission, and we really appreciate all the work that they do, and we appreciate you all's efforts to appreciate them. So we'll go to the next slide. So one of our major priorities over the course of the last 2 years plus has been leading the COVID-19 response for the city. So I wanted to give you all a little bit of an update and overview as to where things stand. As you all are aware, the Public Health Emergency Declaration that was issued by Bphc and then ratified by the Board of Health back in March of 2020 was rescinded on April 1st of this year. And even though that emergency declaration was rescinded, the pandemic efforts and responses are still underway. We want to prepare for potential future surges, so it's definitely a focus of a lot of our efforts. And looking at this slide, I want to emphasize that we are not quite out of the woods. We are watching our trends in our data very carefully, and we're making plans to ensure that our Boston residents are safe and have access to health care as they need it. With particular focus, we pay attention to viral wastewater concentration, which has been increasing. This is of concern because it predicts what's happening or what's going to happen in terms of cases as well as hospitalizations. We have seen an increase in our case rate, and right now our positivity is about 10.8%, so it's almost 11%, with positivity over 8% in all of our neighborhoods. We are very focused in on our hospitalization data because we don't want our hospitals to be under strain. We have seen an increased trend in terms of new hospitalizations, which is a cause for concern and vigilance. We are in close consultation and speaking regularly with our hospital partners to understand what their particular concerns are and their strains are. Just so you're aware in terms of cases, and I've said this in previous meetings, the highest proportion of COVID cases right now are in those under 50. But hospitalizations are increasing over all age groups, particularly in the elderly population, which is of concern. We know that older individuals remain at very high risk for severe outcomes and negative outcomes from COVID-19. So our focus right now at the Commission is really working with the public, with the communities in terms of communication, to provide accurate, timely information about their risk and to provide them with strong recommendations about what people should be doing to mitigate their risk. Important in that is that we're really emphasizing testing, and I'll tell you a little bit more about what we're doing in terms of our testing resources. And then we're also emphasizing the fact that therapeutics or treatment is available, particularly for those at highest risk. So I think that it's important for us to stay focused in on what we're doing in terms of vaccination and boosting. Overall, 73.4% of Boston's total population is fully vaccinated. 54% of those who are fully vaccinated have received their first booster. Unfortunately, we do not have data yet from the state on the proportion of uptake of second boosters. On this slide, you see the maps to your left are highlighting persistent disparities by neighborhood. The lighter colors in both maps indicate lower levels of vaccination and boosting. By neighborhood, as has been the case since vaccination and boosting was rolled out, Mattapan does have the lowest vaccination and boosting rate. However, I do want to emphasize that that disparity has been decreasing. Most recently, approximately 59% of Mattapan's residents are fully vaccinated. So we've been working really hard with community groups and with key stakeholders and with residents to ensure that they have access and they feel confident in terms of their vaccination. I also want to briefly mention, it's not on this slide, that we continue to note disparities in vaccination amongst those 5 to 11. So these are our kids, which we are very concerned about. 70% of white children, 65% of Asian, versus 33% of Latinx and 26% of Black children have been fully vaccinated at this time. So we've been working really hard in terms of our COVID-19 response as a city to make sure that testing is available. Our standing PCR testing sites, Anna Cole, Bowling Building, and West End, have remained open and active and available for services, all of which is free. We've also, in the course of the last year, distributed over 1 million individual rapid antigen test kits and put them in the hands of residents who need them most. And then lastly, I want to mention in terms of COVID-19, we are developing a COVID-19 surge plan for the city. This has been an ongoing process, and we're working with a number of different stakeholders to get this out as quickly as possible. Basically, we want to make sure that we're able to scale up our operations very quickly in the case of ongoing surge, future surge in terms of the fall and winter. And we should have this plan finished and available for review this summer. So I'd like to talk a little bit about some of our other accomplishments, just because there's a lot of work that we're doing at the Health Commission. One of the things that I think is important to mention is our work to advance and to essentially advance the work and eliminate health inequity. Bphc was among the agencies that received funding to support the implementation of the Declaration of Racism as a Public Health Crisis. This was incredibly important in terms of both the city's statement of this is a problem, as well as the funding that was allocated. What we've done with this funding has been instrumental in getting a better sense of exactly what the disparities are around the city, having data available. We're working towards improving our data that's available, and I think that this has been incredibly important. We outlined a lot of this in our accomplishments document that was submitted to you all prior to this meeting. I also want to mention briefly the work in regards to the public health response to addiction and a lot of what we've been doing in terms of mass and CAS. You all are aware that this afternoon we'll be talking about this work in more detail, but just to say that it's certainly one of what we consider to be work that's ongoing, but it's certainly work that we've spent a lot of time on, and particularly the tent to housing initiative, moving people from the encampments to low threshold housing has been really important. I also want to mention that within that work, we've been focusing on equity. And we did an equity analysis that has demonstrated that we have been able, by race and ethnicity, to get people low threshold housing in a way that we consider to be equitable. But that work is ongoing. We're continuing to focus in on who we're helping and how much services are available for every person who's suffering. I also want to mention our process and what we're doing, and I know I've spoken with a number of you all about this, our work to support efforts in regards to behavioral and mental health. This is something that's been an ongoing initiative. It's something that we've spent a lot of time and effort on pulling this together, and you will hear a little bit more of that later in the presentation, but I'll just start by saying that it's a very strong commitment that the city has made to work with all of you to ensure that diverse services are available for folks who we know are struggling with mental and behavioral health issues across our city. And then lastly, I just want to mention that it's really important that we maintain our workforce and the delivery of core public health services, in particular things like data, IT, surveillance. We're opening a Center for Public Health Science, Technology, and Innovation at Bphc, working with many academic partners, really strengthening our ability to produce good data and working very hard to do so. In addition, we are working towards reaccreditation. We were one of the first health departments in the country to be accredited a few years ago, and that's certainly something that's a source of pride for us at the Commission. So I want to turn to our specific bureaus. So the first is the Infectious Disease Bureau. This is one of the 6 bureaus at the Commission, and their work has really been critical in regards to COVID-19, but they do a lot more than COVID-19. They do overall infectious disease surveillance, investigation of case outbreaks, and work towards funding and promoting a continuum of HIV-related education and care throughout the Ryan White HIV/AIDS treatment work that's ongoing within the Bureau. They also do an enormous amount of work within the community, providing community as well as provider education in regards to communicable diseases. Throughout the course of this past year, IDB, or the Infectious Disease Bureau, has expanded its capacity to deliver services and health consultation in 6 languages, which has been incredibly important for increasing access for individuals around the city. IDB has also provided ongoing content and clinical and infection control subject matter expertise, which has been important for occupational health, both within Bphc as well as beyond. And in FY23, we hope to build on our surveillance infrastructure. It's incredibly important to have that available within our city, and to strengthen our engagement with Boston medical providers, build connections with and increase our community engagement efforts, and increase our understanding of the current needs and service gaps, particularly for people living with HIV. So I'll move to the Community Initiatives Bureau. Through the Community Initiatives Bureau, we support the health of Boston residents in many different ways. I'll just mention a few of those. One of them is the Mayor's Health Line. Throughout the course of the last year, individuals who staff that line have assisted over 10,000 callers. Healthcare navigators helped 765 individuals in enrolling and applying for healthcare insurance. And the Mayor's Health Line staff started assisting residents in SNAP benefit applications. So there's been an expansion of services. Secondly, in our environmental hazards program, the staff responded to 685 complaints of potential environmental public health hazards, and the Tobacco Prevention and Control Program continued its inspection work, conducting 1,300 in-person merchant inspections in FY22. Within the Chronic Disease Prevention and Control component of the Community Initiatives Bureau, we've really been focusing in on prevention. So They supported 25 summer fitness series classes and a 7-part winter fitness series, which is basically an opportunity for people to get in shape, even though some of that was virtual, and they reached 3,800 residents. And then lastly, I'll mention the Boston Asthma Home Visit Collaborative, which conducted over 500 in-person and virtual asthma home visits to support individuals and families with asthma management. This has been really important because we know how important and how much asthma causes disparities within our communities. So in terms of goals for the next year, the Mayor's Health Line will expand and increase its work, particularly to focus in on young men between the ages of 18 and 25 to reduce the numbers of those who are uninsured. The Asthma Prevention and Control Program will expand some of its referral services, particularly in regards to asthma, to our work in Boston Public Schools and working in collaboration with Boston Children's Hospital. And then the Environmental and Occupational Health Team will incorporate the use of a standardized comprehensive healthy homes assessment to ensure that homes of Boston residents are safe. And so lastly, in terms of our bureaus, I'll talk about our Child, Adolescent, and Family Health Bureau. So this is the CAF Bureau, and they really manage a lot of physical and mental health needs regarding Boston families. So children, youth, families, caregivers throughout the city of Boston, really trying to address a lot of the known inequity that exists. So over the past fiscal year, the Bureau's Healthy Start Systems Division housed families through the Healthy Start and Housing Program, provided healthy baby, healthy child services to 828 children, 385 pregnant women, and 522 postpartum women. They also did a lot of advocacy in terms of legislation to facilitate review of fetal and infant deaths, to identify root causes of inequities, particularly racial and ethnic inequities. That's really important. Their behavioral health centers conducted 3,300 visits and expanded telehealth services because that was obviously necessary during this pandemic period. And in addition, I just want to comment that our neighborhood trauma team network provided support to 97% of the gun or stabbing incidents in the city throughout the past year, and provided services to 587 residents impacted by violence. So in the next year, we plan to continue this work, as well as expanding, particularly to increase support for youth mental health needs, and we'll talk a little bit more about that later, and providing funding for community-based collaborations to respond to families surviving death by suicide. So now I'm going to turn to Tim Harrington to review some of our budget items.
Sure. Good morning, everyone. Again, Tim Harrington, Director of Administration and Finance with the Health Commission. I just want to run over some of a brief overview of our numbers for all of our bureaus for the Health Commission for FY23. For our Bureau of Recovery Services, the proposed budget is $8.9 million, which is an increase of 3.7%. For our CAF Bureau, it's $14.7 million, an increase of 1.3%. For community initiatives, it's $5.9 million, an increase of 2.2%. For Boston EMS, it's $71.5 million, which is an increase of 5.1%. That's due to a new investment, which I'm going to talk about in the next slide. For homeless services, their budget for FY23 is just over $8 million, which is an increase of 8.22%. The majority of that increase is due to the inflation, due to an increase in their food costs down at the shelters. For IDB, for infectious disease, the budget is $6.3 million, an increase of 2.5%. For our public health service centers, the budget will be $22.1 million, an increase of 19.25%. Again, that's because of a proposed new investment, which I'll talk about in a minute. For our administrative offices, $10.5 million, an increase of 4.78%. In our property division, the budget would be just over $5 million, an increase of 4.35%. EMS revenue proposed is $37.8 million, a proposed increase of just over 6%, and then our OPEB figure is level from last year, $2.25 million. For our proposed new investments for FY23, I'll go through these. There's going to be a few different slides throughout the presentations, both this morning and this afternoon, to talk about each one of these. The first one is 4 EMS FTEs to staff a co-responder unit with our best clinicians. Then 20 EMS FTEs to staff 2 additional frontline ambulances. Chief Hooley will be here this afternoon to talk about that, actually to talk about both of those. Then there's a proposed transfer of funding from HHS of $1.75 million for the citywide mental health response. There's 4 FTEs proposed for our behavioral health initiative. Dr. Ojakutu will talk about that investment in a moment. There's increased public health and medical response to emergencies in our Office of Public Health Preparedness, which is 12 FTEs. Again, there'll be a slide on that coming up. And then these last 2 are in our Bureau of Recovery Services. One is increased storage for our clients down on Atkinson Street, and then a dedicated epidemiologist for recovery services, which is 1 FTE. And then I think there's 2 additional slides on 2 of our new investments.
Great, thank you, Tim. So as Tim mentioned, there are 2 new investments that I'd like to talk about very briefly. One is regarding the Office of Public Health Preparedness, and they have led much of the Commission's work in regards to COVID-19, but they also do a lot of other work in regards to emergencies and sort of preparing our city along with other city departments to withstand any sorts of emergencies. So this new funding would add 12 FTEs to our office, which would allow us to support work at all phases of the emergency management cycle. The focus of these individuals who will encompass these 12 FTEs would be community resilience, so helping to minimize the public health and medical impacts of emergencies on residents. Planning and training, so making sure that we have the plans and the skills to respond to emergencies and build disaster behavioral health skills. And then workforce resilience, so training and managing a deployment program for responders in the days following emergencies. So we think that all of this is very critical to ensure that our city not only withstands future infectious disease emergencies, but other emergencies that we know can occur. One of the areas that we are most concerned about is disaster behavioral health and suicide prevention, and this funding will also help us to operationalize and implement some of the multidisciplinary and multi-agency work that we have been planning for in recent years. So I will also talk very briefly about our Center for Behavioral Health and Wellness. So this is the 4 FTEs that Tim already mentioned. As I mentioned earlier, this is a really key initiative within the city to address many of the unmet behavioral and mental health needs across our city. The purpose of this center, which will be located at the Boston Public Health Commission, will be to work with many of you and many of the other organizations, both in the community as well as in academic centers throughout the city, to address a lot of needs and provide access to services, as well as ensure that there is a diverse pipeline of service providers to address the many mental health and behavioral health needs that, as I mentioned, are unmet. These 4 FTEs will include a Chief Behavioral Health Officer who we have identified and will be hired soon, and hopefully will be announced soon, as well as staff for the center who will be working both, as I said, within BPHC as well as externally with other groups and other departments throughout the city. So now I'll turn back to our new capital budget requests and turn it back to Tim.
So these are our new capital budget request for FY23. Within the materials that we submitted is the full list of the ongoing capital budget requests that we have at BPHC, and during the hearing I'm happy to answer any questions about them. But these are the new proposed requests that we have for this year. First is our Northampton Square garage structural repair. The proposed amount is $400,000. It's necessary repairs throughout the entire 3-floor structure. And it's to address water penetration issues from the plaza deck with plaza tile repair and waterproofing really throughout the entire garage. That's something that needs to be done. And then the second new request is at 201 River Street, our transitions building out in Mattapan, and it's $4.85 million for a proposed new HVAC system in that particular building. It's something that's kind of long overdue. So those are our 2 new capital budget requests for this particular fiscal year.
So that concludes our opening presentation, and we're happy to take questions. Thank you.
Thank you so much. I'd just like to acknowledge that my colleagues, Councilor Frank Baker and Councilor Kenzie Bach has joined us, and I also have a letter to read from Councilor Julia Mejia, who is absent today. Dear Madam Chair and members of the Ways and Means, I am writing to inform you of my absence during today's City Council hearing on Docket 0480 to 0486 FY23 Budget, Boston Public Health Commission. A representative from my staff will be listening in and following up with me. I look forward to reviewing the footage and following up as need be. I am submitting the following questions to be entered into the record with the hopes of getting a response from the administration either during or after the hearing. I'll allow Councilor Mejia to have her 8 minutes. I'll read them into the record, and if we go over, then I'll continue in second round. First question from Councilor Mejia. Can you provide us with some information regarding the Youth Development Network? How many people are currently staffed in that program? What are their responsibilities, and what are they being paid for that work? Our office has heard of some staffing troubles and retaining talent in the YDN. Could you talk through what the hiring and retaining challenges are and what the plan is to recruit more employees in the YDN?
You'd like me to answer?
Please.
Each one now. So I think that overall there are hiring challenges across the commission, and I think this is not just here, but it's in public health departments, across the country. I have looked at our staffing, both within the CAF Bureau as well as across the commission, and we have a lot of positions, a lot of openings right now, and this has been a challenge. I think that there are many reasons why that challenge has occurred. Certainly one being our compensation, which is an issue that we're working on, and I'll talk about what we're working on when I'm done with the issues. Two, I think the residency requirement has caused challenges for people, largely because of money, and the high cost of living in Boston. And then I think in general, we've been working on a number of, issues related to staff appreciation and people feeling tired and, a little worn out by COVID-19, by the work that we've had to do. And I think it's important for us to acknowledge that our workforce in general, and I specifically say, our public health workforce is drained right now. So if I could speak specifically to what we've done and what we're working on and why we think that this is so important. Within the first week of me starting this role in September, we did a survey, a staff, survey, and just to understand where people are at. What are they feeling? What are the challenges that they're facing? And from that survey, we took those responses and we developed the Workforce Improvement Program. We call it WIN. And WIN, in and of itself, focuses in on a number of different areas, including increasing staff appreciation, working on increasing compensation, working on workplace wellness and mental health concerns that people have within the workforce, diversity, equity, inclusion, which are ongoing problematic areas. I'll say that it's something we're working on, but it's certainly something we can all improve on, as well as other issues, particularly, concerning, how, well people actually feel appreciated within the workplace, and what is it that we can do in terms of increasing communication between those in the executive office and our staff in general. So this program was rolled out in September, and since then, I think we've had a number of achievements within WIN. One, we are working on issues related to staff morale and staff appreciation. We have an employee wellness program that provides opportunities for, mental health, behavioral health, expression, staff support, and we do that on a weekly basis. We've increased our communication. I reach out to staff, speak to staff one-on-one. I have open door office hours, and we've gotten a lot of good feedback from that. I think that in and of itself makes people feel like they belong. We are doing an enormous amount in terms of recruiting, trying to recruit a more diverse staff, and I think we have been working in that regard, and we can provide you with that data if you would like. And we are continuing to meet to discuss compensation. You know, I think that some of that's a bit out of our control, but we are working on it. And I can say that we're meeting once a week, our entire staff, human resources, executive office, finance, all of us, to talk about how we can incentivize people to stay in public health, because this is our essential workforce. And I think that speaks to what we're doing in terms of not only the Youth Development Network, but all of our programs at the Commission.
Thank you. Can you, Councilman Mehar's second question, can you talk a little bit about how Bphc and Bps coordinate with each other, particularly around mental health and wellness, sexual health, and in terms of how you both coordinate with community-based organizations?
So I think collaboration with public safety and BPS is critical. Just to tell you, I just came from a meeting from 9 to 10 with BPS because it is so critical that we work together on a number of different issues. I think that we have worked together quite collaboratively, particularly with our neighborhood trauma network and a lot of the work that they do. I think that there's been interaction, working together, coming up with sort of common goals. I think everything is a work in progress. One of the areas that we're working on that you all are all aware of is the public health and public safety response to addiction, and a lot of the work that's going on in the Atkinson, Southampton, and Topeka, Bradston connector area. And that is what the meeting was that I just attended. I think that we have to work together. We don't have a choice, because a lot of the issues that we're dealing with, they're not just public health issues. We are talking about public safety, and we have to have a common goal. And I think we're getting there. It's challenging sometimes, but I think that we definitely understand the importance of BPS. And you talking about, you said Boston Public Schools. I'm sorry, I thought you were talking about BPD. It was on my mind to talk about BPD.
I did hear public safety, and I just wanted to
Yes, I
see
apologize.
if that was going somewhere else.
Yes, I totally apologize. Exactly, exactly. And my mind was on it because that's where we came from. Okay, so I apologize for that. So let me go back. So BPHC obviously works with BPS on many different levels. Let me just give you an example, and I'll be brief because I know that now I've taken up a lot of time. So one of the areas that we work very closely with BPS is on, a hot topic right now, obviously, is COVID-19. So we have our medical director of our Infectious Disease Bureau who works with BPS to coordinate all of the efforts in regards to COVID-19, whether it be from testing, the surveillance strategies, the pool testing, as well as the rapid antigen testing, developing protocols, procedures. She essentially spends probably about 70% of her time with BPS. I also meet with BPS on a regular basis to coordinate activities, and this ongoing ability to coordinate, I think, has made Boston Public Schools safer for kids as well as families in multi-generational homes living with vulnerable parents and grandparents throughout this pandemic. So I apologize again for deviating, but I hope that answered your question, or Councilor Mejia's question.
No worries. Councilor Mejia only has a few seconds, and the other two questions seem to probably need the same amount of time, so we'll reserve her last
Okay.
questions for later. First on my list, I'll go to my council colleagues and with myself. Councilor Murphy, you have the floor.
Thank you. Thank you, Chair. And thank you for that presentation. Get right into my questions here. What more can we do to support the mental health crisis? We know it's the pandemic within the pandemic, and we'll be recovering for probably decades coming out of this. And how are we going to proactively fund and support more mental health services that we're a healthy and striving community coming out of this, that if we're not coming ahead of it and waiting and then reacting to things that we know are going to come up. And I know myself and my colleagues here are strongly advocating for our youth and young adult mental health services, but my question is specifically if you can speak to expanding the mental and social emotional services for our seniors and veterans. That's my first question.
Thank you for that question, Councilor Murphy. Part of the plan with the Center for Behavioral Health and Wellness, which is what I described earlier and what we have acquired we're asking the 4 FTEs for, is to explore and expand services, not just for youth, because I think that we're talking about across the age span, but also to expand services for elderly individuals and for veterans and for all Boston residents. That is incredibly important. We know that there are unmet needs. We've done a number of surveys, most recently one done by our Office of Racial Equity and Community Engagement, which basically showed that that was a top priority for many of our residents. And not only is it a top priority, but it's a priority that we hope to make services more diverse. I mean, people don't just want mental health services, people don't just want behavioral services, they want services in languages that that are their home languages, and they want services by diverse providers. And they don't necessarily want standard, mental health services. They want things that are familiar to them and acceptable to them. Mm-hmm. And that's absolutely what we're focused in on.
Thank you. And could you speak to where in the budget you are supporting community health centers? We know that many of our residents use them for lots of their medical and health services, and needing to expand those services and connecting with our residents more. So is there an investment to support more in our community health centers?
Yes, there is. We certainly have in our budget where we've supported and will continue to support community health centers, both not just in COVID-19, because that's certainly been a priority, and we've offered funding and will continue to offer funding to them to increase testing as well as vaccination. But for other services, we also provide support to most of the community health centers. It really is, though, about our communication with them. Some of them need more than others, and we try to gauge it based on what their needs are.
Okay. And you mentioned it a few times, and I understand and appreciate that COVID-19 has completely overshadowed almost everything you're doing at the Public Health Commission. But we know that there are countless other health and medical needs of our residents, and people have missed regular checkups, cancer screenings, so many other important regular checkups, that keep us healthy. So what are you seeing already, and what are we doing in this budget to make sure that we're getting people to the hospital and to the doctors, not just for COVID testing, but for other life-threatening diseases that we're seeing are coming up with younger and younger people now?
Absolutely. Thank you, Councilor Murphy. And I think that's one of our main concerns, both in our interactions with community health centers and in our Community Initiatives Bureau. So we plan to gear the funding that we are offering and would make available to community health centers to focus in on addressing some of these other needs. It's maybe it's called collateral damage from COVID-19, where so many people have been out of care. That will be the target of the funding that we will be, allocating to community health centers. I think, it's also very important for us to note that we do have community outreach and community health workers. We have the Mayor's Health Line. We have services available where people are not just getting access to, resources related to COVID-19, but certainly they should reach out and avail themselves of the services that we have to deal with many health issues.
Okay. Before I run out of time, and I know this afternoon's focus is on the homelessness and recovery, but I do want to go on record saying I'm definitely in support of rebuilding the Long Island Bridge, but I do notice on page 108 in the budget, if you could just explain why we're continuing to spend 1.3 million out there and it continued to go up, since it's closed. So if we could talk about what that expense is there.
Sure. Yeah, the 1.3 million is essentially the utilities
That's okay.
to cover those buildings out there, electrical and water. My sense is that number has stayed the same over the last several years.
Okay.
And then as far as the larger plan to renovate those buildings, there's kind of a two-stage process that we're working with on the city. Stage one is the stabilization of those buildings, which is a $20 million figure that the city's going to do. And then there's the much larger plan. Bphc will be, very much involved with all of those discussions around future of the campus and what it'll look like, but exactly the renovations and, just sort of the upkeep of all those buildings, we're working with the city to handle all
So
of that.
that's the cost to just keep.
Yeah, the 1.3, it's to keep the lights on. and
Yeah,
keep
the lights
water
on,
Yeah.
that makes sense. And one other, on page 107, it looks, behavioral health. It shows nothing, 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 and then 2.4 million. Is there a reason why we weren't spending anything directly in behavioral health until this coming year?
Sure, that's part of the new investments that we have. The 4 FTEs of the proposed behavioral health center is $666,000, and then the proposed transfer of funding of this mental health work from HHS is around 1.75 million. So add those together, that's the new 2.4
Okay,
million.
that's
towards
good to
those
hear.
efforts.
And do we have an idea of how many people we'll be able to reach and support with that amount of investment?
I don't think we have a targeted number of people. We're hoping to do a lot of coordination, education, communication with people to overcome the stigma and address some of the workforce needs. We're trying to, with a lot of the initial money, we're really going to be trying to build a better pipeline of providers, like I said, who are diverse and hopefully able to meet the needs of Boston residents.
Thank you. That's it, Madam Chair.
Thank you, Councilor Murphy. Councilor President Flynn, you have the floor.
Thank you, Madam Chair, and thank you to the panel for the important work that you're doing. With the recent accident at the Boston Edison plant, I'm concerned, and I've expressed this, about the air quality in the neighborhood, potentially harmful chemicals or asbestos could have been released into the neighborhood. I did ask for a way for us to monitor the testing in the neighborhood to make sure that some of this pollution is not going into the community. Ongoing testing and, monitoring is critical. Are you working on that issue, and can you give us an update about it? I know I've reached out to various city officials about that.
So I think that's an incredibly important environmental health concern. Our environmental hazards program does a lot of work preventing as well as monitoring and dealing with public health hazards. Over the course of the last year, I mentioned that we addressed more than 600 of these sorts of issues, and certainly that is something that we work on. But in terms of specifics, I will need to get back to you on any specifics related to that incident.
Okay, thank you. And the reason I bring it up, my neighborhood in South Boston, we have the highest rate of lupus for many decades, actually, scleroderma as well, various respiratory issues. So my constituents have asked me to make sure that I focus and prioritize health, their health as well. So just wanted to follow up and thank you, Doctor. I'm glad you brought up and talked about HIV and AIDS. That's an issue I've worked on with Chief Martinez for a period of time. So how is this budget helpful to persons living with HIV and AIDS in terms of getting them the critical support services, resources that they need?
So I appreciate that question, Councilor Flynn. I'm an infectious disease physician, and most of my patients, when I was practicing, lived with HIV. So very much so concerned in regards to that issue. The Infectious Disease Bureau spends a large portion of their budget, and we can provide you with the specific numbers, on ensuring access to care and treatment through Ryan White HIV/AIDS treatment-funded service providers. This is an incredibly important part of the work that we do to ensure that sites have the ability to have a safety net so that people can have access to antiretroviral therapy, as well as the care that's needed to support people who are actually on treatment. We are a part of the Ending the HIV Epidemic Network throughout Suffolk County. We've been given access to funds and to work with community stakeholders to partner around this issue. It was a federal initiative that came down and then is now focused on counties, sort of local areas, the goal of which is to eliminate HIV, or decrease it significantly and then eventually eliminate it. So we're very much so involved with that network. We work with providers on a monthly basis to discuss care and treatment needs, as well as to look at issues of prevention. And we're certainly very concerned, particularly not just individuals living with HIV, but the preventive piece, particularly when we're talking about issues related to risk, related to injection drug use, as well as other risk that is ongoing within our communities.
Thank you. In this book here, I read it frequently. The 2016, 2017 Health of Boston. Are we still putting that edition out?
So a decision was made. I've seen that book and I've looked through it and I thought it was very useful. A decision was made years ago prior to my starting that we shift to doing a different type of dissemination of Health of Boston metrics and data. A number of things have gone on to modernize the way we present our data and to help stratify and get a better sense of what's happening for different race, ethnicity, as well as people of different, from different countries of origin. So one of the things that we're doing within our Center for Public Health Science and Technology is coming up with a dashboard, so that dashboard would be available to anybody, including the counselors, so that you could find all of that information updated, routinely updated, so you would know what's happening by neighborhood, by different health metrics. So that's one of our goals, and we're working on that, again, weekly here at the Commission. So the other piece is that we are also engaged in BHEMS, or the Behavioral Health and Equity Measures, the Boston Health Equity Measures, where we're basically working with hospitals and clinics to get data from them and be able to talk about that in a more robust way than we might do by self-report. So we're working on that data, and we will hopefully be able to display and make that available, disseminated to community members in that way. And then there are a number of other things that we're doing to really modernize our data. I agree that we need to have documents like the one that you have, but I think that they can be presented in a way that would be more useful to you, actually.
Okay, the biggest, I used to love reading this all the time. The biggest concern I have, and I've asked Public Health to work with me on it, is they don't break down the demographics enough for me. And I say that because the Asian community is at times considered just one large group, whereas the Chinese community in Chinatown has the highest asthma rate of any ethnic group in the city, but that doesn't necessarily mean the Vietnamese community in Dorchester does. So they're different, and the Chinatown community is grouped in as part of a zip code with the people from the Ritz-Carlton right next door to Chinatown. And so I'm reading about demographics that include the Chinese community that are immigrants mostly and elderly, and they're in with wealthy families living in the Ritz-Carlton. So what I'm saying is I don't get a good read on it because they're considered one group, and it's been frustrating for me to distinguish, and I think the percentages are off because I know the people at the Ritz-Carlton have much better health care than the people in Chinatown that are immigrants. So what I'm asking is that we really even go further into the demographics and distinguish between Asian population living in poverty that might be living next door to a millionaire living in the Ritz-Carlton Hotel. So that's very important to me because it's very important to my constituents, and I need to have an accurate description of the results and demographics. So if you could work on that, that's my major request. I've been asking for that for 5 years, and no one seems to want to do that for me. But it's important for me to get that information. But having said that, I know my time is up. Thank you, Madam Chair.
Can I respond to that, though? Because that is also extremely important at the commission, this idea of understanding who people really are, and to understand nativity, what their country of origin is, and actually where they live beyond these, neighborhood geographical boundaries, to really get down to the census tract level. That's part of what I was sort of explaining. That's what we're trying to do. We're trying to get better data for you. So the BHEMS, the Boston Health Equity Measures, that is going to go to a more granular geographic level, so you'll have more information by census tract within your neighborhood. And I also, with this precision dashboard that we're working on, we are looking at issues of country of origin and who people are, where they actually sort of see them, so who they actually see themselves to be, as opposed to lumping them under umbrellas of race and ethnicity that may not mean much. So we're definitely, I hear what you're saying, and it just takes a little bit of time to work on data, IT, surveillance, that type of infrastructure.
Okay, thank you, Doctor. I appreciate it.
Thank you, Councilor Friend. Councilor Lujan, you have the floor.
Thank you, Madam Chair, and thank you to Bphc for being here. Dr. Ojikoto, I don't know if I missed this, and so apologies if I did, but you referenced the citywide mental health response as like a singular entity. So can you just describe what that is?
So I should probably be very clear. There is no singular sort of entity per se.
It'd be great if we did.
Yes.
So what is that?
So what we're trying to do with this Center for Behavioral Health and Wellness is to ensure that there is a sort of a central location so that people know where to go, so that they could be connected with, or we could coordinate with other entities. We're doing a lot of behavioral and mental health work across the city, but it's not always coordinated. There's oftentimes gaps that we know are unmet, particularly based on some of the surveys, the community engagement surveys that we've done. And the idea with that particular center is to laser focus on some of the gaps that have already been mentioned. So this issue of workforce, this issue of diversity, this issue of making sure that concerns that different communities have are being met. So that would be how we were planning to approach the center. And in that way, we hope that it would incorporate, be inclusive to everybody across the city. Mm-hmm. But I don't think there's any one, sort of solution or way to move forward, and people, will continue to do the good work that they're doing.
Okay, so let me just give an example. Like if I'm an immigrant, arrived in this country. I had COVID. I have 3 kids. We've been suffering from displacement. And I just don't know what to do. I'm suffering from mental health, let's say, suffering from a bout of from depression, and I come to Bphc. What is the response? What does that look like?
Mm-hmm. So I think that's a great question.
And I don't have health care, so what does that look like? I come to Bphc.
Exactly. So I think that's a great question.
And I don't speak English.
So that's a lot of people, right? Mm-hmm. So it's not like that's an unfamiliar
scenario. It is not, because they call me.
Yeah. I think that one of the things that we will be doing is working with our community health centers to ensure that they have a better access, a better navigator system, better CHWs, better community health workers who will be able to navigate people into a stronger array of services. I think that a resident that you described might first talk with someone from our mayor's health line to be able to get them some health insurance first and foremost. We support, I believe, 9 different languages on the mayor's health line. Mm-hmm. It's something that we also get a lot of calls about on a daily basis. So part of this center is not to necessarily be a direct service provider, but it is to help coordinate so that people know where services are available. It's online, and if you don't have access to online, we have the mayor's health line. We have other people who can provide some sense of direction for folks. And I think that's what's missing in a lot of ways.
Right. Okay. I would be, when I mentioned the citywide mental health response, I know that there's not a singular one, but I think when we're talking about the mental health issues that we're facing that have really become more acute as a result of the pandemic, especially for Boston Public Schools, but just generally for everyone, and for the diversity, for Boston's diverse population, I would like to see what does our mental health plan look like for this city. Mm-hmm. I think that would be something that's really valuable for us as city councilors to have, but also for residents in the city of Boston to know that we appreciate the mental health issues that our residents are facing. And here's our general plan of what access to resources would look like. Even if there's not like, it's not like this singular idea or the singular office, providing folks with a roadmap, especially, where it's Mental Health Month, I think would be really helpful for populations that actually aren't used to, for a number of reasons based on stigma, aren't used to really acknowledging their issues as mental health issues. A second question I have is, this is a formal request for information about what programs and partnerships BPHC provides for returning citizens and those who've been justice involved.
And I would like to be comprehensive there, so I would like to get that response to you, which will provide an overview of services that are available, and probably, we work also with the city on that, so I think it would be helpful if we got you back with a formal response.
Okay, thank you. And what does BPHC's partnerships look like with mental health, like, third-party providers around in the mental health space who are themselves either, I'm thinking about about vulnerable populations here, who we can refer or work in partnership with when it comes to returning citizens or immigrant communities or just Black and brown therapists. What does that look like? What does the infrastructure that BPHC may be building? So we know that there's a greater likelihood for folks to access or try to get mental health services if their providers are also share similar demographics, and that's an area where we're lacking. And when I look at the numbers regarding who BPHC is contracting with, that doesn't provide much comfort either. So what's being done there?
We're building that capacity. I mean, that's really one of the key focal points, this idea of what do the services look like and what should workforce look like in terms of mental health. I think that's going to be a key role of this new center, and we're gearing up to move that forward. But it's definitely high on our priority list.
Okay, what did that look like? What was there any intentionality prior to the center in terms of making sure that we were working with providers who could speak a language or who were Black and brown or from Roxbury, formerly in justice involved?
So I believe that there was intentionality. I mean, there have been several programs, and I can speak to a couple specifically, but in general, definitely being inclusive of people who are diverse and who are coming from the communities that we know are hardest hit by a lot of these issues. That's part of the mission of the Boston Public Health Commission, and certainly part of the mental and behavioral health work that we're already engaged in. I think the key thing, though, is that we need to scale that up, and we need to be more intentional than we have been about getting that work done, because there's clear that there's an unmet need. So that's why we've made this a focal point of our work going forward.
Thank you, Dr. Ojikotu. And another question is, can you just describe sort of the formal relationship, if any, that exists between BPHC and community health centers? Because I think it's important for us to know what the strength of that relationship is and is not before we call on BPHC to do a lot more. I know that for me, a point of frustration was, during the pandemic, has been the lack of capacity of some of our community-based organizations, particularly in Mattapan, to really meet the needs of testing, to meet the needs of providing vaccinations. And every time I was told, well, we don't have control, or we're not really able to step in. So what does that relationship look like, so that we know what we need to do on our end to advocate for strengthening the partnership between community health centers and the city?
So that's an important question. So as I mentioned before, we do provide funding to the CHCs, but it's very different depending on which CHC it is and how capacitated they already are. They may not ask for funding in certain areas. So we definitely have that sort of formal relationship with them in regards to providing funding, and that's been going on for years. That relationship in terms of funding increased because of COVID-19. So then we had larger contracts that were available for CHCs to engage in testing and vaccination outside of their own patient population. And some CHCs did that, and they did a lot of work, and others took other opportunities and did other things and provided services in their own way. The other piece that I think is important to mention is that on our Board of Health, we have CHC designated seats. The Board of Health is really important for the Boston Public Health Commission. We take direction from them. They actually, approve our budget, so they are aware of what's happening. So currently, Mattapan Community Health Center is represented. So Guale Valdez is there, and then we have some new members who you'll hear about in subsequent sessions. So that's another important piece. The other piece is maybe less formal, but our staff attend the Boston Conference, which is the leadership meeting of the CEOs of the community health centers on a regular basis. So we're hearing from them. We know what their issues are, constraints are. We bring topics to them and see if they can scale up services in that regard, which I think is an important piece of this. So if there are challenges, we're able to bring it directly to them.
Yes, but I know that my time is up, but just to clarify, there's no dependent relationship between the community health centers and BPHC.
No dependent relationship, but I just wanted to be specific about what it is that we do.
All right, thank you. And thank you you've been working overtime on the issues facing our city, specifically with the pandemic. So I just want to, hats off to you for all the work. I know that it's a challenge, especially even right now as we are looking at wastewater levels and thinking about, which way to go. So I just want to commend you because it's a hard space to be in, and you're doing a great job. So thank you.
Thank you. I really appreciate that, and I'll share that with my staff because
Yes.
they're really doing the work.
Councilor Braden, you have the floor.
Thank you, Madam Chair, and thank you, Dr. Ochokoto, and thank you, I found your name. Thank you both for being here this morning.
Tim Harrington, good morning.
Thank you. First off, I want to thank you for the testing site at West End House in Alston. That's it's been a game changer out there to help us just track what's happening, and we really appreciate your help in getting that established or re-established again when you came in. Thank you so much. One question, I see you have Healthy Homes Assessment, and I was wondering what that involves and how is this coordinated with the Boston's Inspectional Services Department, if it is. And then on the mental health side, there's the pediatric behavioural health. We have a crisis, and I don't know in terms of how preventative care or working with other agencies to improve behavioural health, mental health of our young people, so that they don't end up in the emergency room, being more proactive in that space. I had a question about one thing our office has been working on is the census undercount. We reckon that Alston Brighton's undercounted by about 5,000 people, but we also know from the demographer at the BPDA that his estimation that there's an undercount across the city of especially immigrant families and folks who English is not their first language. And I don't know what do you rely on the BPDA research for your demographic data, or and the city's mapping office for geographic analysis? Then the other question, and I'm going to try and give you a couple of quick ones and I'll come back for a second round, but Councillor Sabi George worked on getting a sharps disposal set up, and I think we all thought that was an incredible necessary thing to have in our communities, because we have so many folks who use sharps, be they diabetics, people who are giving shots to their pets, or and we are finding that when it comes to actually implementing that new policy, that we're not seeing those sharp disposal units. Those places, our pharmacies aren't cooperating or doing it for us. So we're wondering if where we are at with that. And then the staffing and recruitment and retention all across the city, all of our departments are having these problems, but we're wondering if BPHC is partnering with our local universities and their schools of public health to try and introduce people to the, potential staff to the BPHC, and also to help recruit, get them into the pipeline and recruit those staff. And I think that might be enough for now to get started.
Great. Okay, so I'm going to tackle those one at a time. So in terms of the Healthy Homes work, Our Healthy Homes inspections do result in referrals to ISD when code violations are found, so we do work in conjunction. We do that. In terms of the types of things that they actually look for, I'd like to provide you with a more robust, like an overview, so that you know exactly what they will be looking for in terms of inspections. Your second question was about mental health in general. I think I did speak a lot about. I spoke less about prevention, so I think that was your your perspective, and I think that is obvious. That's an obvious piece of work that has to be done, and it's part of our Center for Behavioral Health and Wellness. The Chief Behavioral Health Officer, who we hope to hire, will be somebody who has that in their experience, and particularly has it in youth in terms of dealing with mental health issues or preventing mental health issues. We specifically looked for that, and hopefully that announcement will be made soon. In terms of the census data, yes, denominators matter and they're incredibly important. I've been talking to our research and evaluation office in regards to how we're determining denominators and understanding what our population count is, and they've been doing an enormous amount of work to sort this out. So this sort of relates to Councillor Flynn's question earlier. We are really doing some restructuring there and making sure that we're not undercounting people, making sure we actually know who people are, language, ethnicity, country of origin. So we're working on that. So, but that's definitely high on our priority list. Now, in terms of Sharps disposal. So my understanding is that we supported the adoption of a Sharps ordinance and are supporting ISD, who they are taking the lead on implementation, not us, but we are working together with them. And I understand that's an incredibly important issue. The last thing you mentioned was recruitment and retention. Yes, this is a huge issue across all public service agencies, and it's been a struggle. We are working with and will continue to work with our local high schools as well as community colleges and the other universities to make sure that help make sure that there's a pipeline of folks who are interested in this work. We have been attending job fairs on a regular basis. We have 2 individuals on our in our HR who are in community engagement work, who do this work on a regular basis to recruit folks and do presentations on a regular basis. It's certainly of the utmost concern. I mean, public health infrastructure, it is the stuff I talked about with data and IT, it's these agencies and these bureaus, but it really is about the people. So we definitely have that as one of our highest priorities.
How are we doing for time, Madam Chair?
A minute in, about 2 minutes.
Oh, I've got 2 minutes. Fabulous. Let's see. So how many best clinicians will we actually have for this financial year coming forward? Like, I think we budgeted for 15 last year. How many will we end up with?
I don't know either. I don't know the number. Can we get that information
Yeah,
back
that's
to you?
fine. Yeah. And then the Division of Violence Prevention, it seems like just from your presentation that a lot of it is trauma support, which is hugely important, but again, back to the question of prevention, what strategies are we implementing to try and prevention? It's curious because when I came here in 1995 and I worked at Boston University Hospital, we had a presentation about violence prevention and research into gun violence, and then all the funding was taken away from researching gun violence. But, how are we working on violence prevention at a very sort of grassrootsy sort of level?
It's of the utmost importance in terms of our FY23 goals and initiatives. It is to work not just at Bphc, but across city agencies to advocate and support the development of a comprehensive violence prevention plan for the city of Boston. So it's incredibly important, and we're maybe revitalizing some of the work that you're referring to.
Yeah, and then back to pediatric or young youth behavioural health, mental and behavioural health. Are we working? What agencies or other non-profits groups are we working with? I know in Alston-Brighton we have Alston-Brighton the Pauses group that previously was the Alston-Brighton Substance Abuse Task Force, and they do a lot of work with youth and teach stress management strategies and wellness as a focus as their preventative approach. What other agencies are we working with? And how do we support those groups?
That's a great question, and I think I'm going to need to get back to you with a list of the actual agencies that we're working with. We do work externally with a number of different organizations. The other piece is that with this Center of Behavioral Health and Wellness, we will be convening an external advisory committee, which will include a number of community-based organizations in order to make that actually community-oriented and work, because there are a lot of things that are happening, as you mentioned, that we want to incorporate within the center.
Very good, thank you. My time's up. Thank you, Madam Chair.
Councillor Braden. Councillor Bach, you have the floor.
Thank you so much, Madam Chair, and thank you so much, Dr. Ojikutu, and to Tim. I want to echo Councillor's thanks for all that Bphc does every day, was doing long before the pandemic, and then has sort of done in high gear during the pandemic. I really appreciate it. I wanted, in the context of all that work, it's always like slightly crazy to add things to your docket. But I know that this pilot funding is shifting over from HHS to you guys in terms of coordinated mental health response. And I'm trying to get a better feel for where we are with that whole process. Cause if it's obviously, we've gone through a bunch of transition in the city, and my understanding, last year we kind of put money into looking into the emergency mental health response with a couple different prongs. So there's the co-response prong, and you guys have this increase for the best clinicians. But it was important to the council, it's important to me, that there be a significant strand of that is looking at not co-response, but actually unarmed mental health response for appropriate calls. And I know that that's something that we actually RFP'd out to have somebody work on a community process, and I think we procured that, and I think that work is extending into the coming fiscal year. But what I don't really totally understand is this 1.75 million, is that operating dollars or a different source? Is it, because I think that was what we appropriated last year, so obviously operating dollars all disappear back into the general fund, so is it renewed? There's still no positions contemplated there. So I'm kind of trying to think about, okay, when the October stuff is over, do we have funding in the budget to potentially implement something? I just think it was a whole soup of different things, and I think there's a lot of interest in the council and where we go on that systemically, and so I just would love to understand better where we are.
I'll answer briefly on the budget aspect of it from what I understood from before. Yeah, you're correct, Councilor, that 1.75 million, there's no FTEs tied to it. It was part of the city budget. I'm not sure how it was used previously. It's being transferred over to us. At this stage, I think, Dr. Ojikutu and the rest of the executive team, we're going to decide exactly how we're going to use that, whether or not we can use that for, both mental health sort of funding or attach any FTEs to it. But do you want to add to that?
Right, so there's still a lot of, I think, discussions around how to divide that money up. The work that has moved forward, I'll speak to a portion of that, the community-led design group, which I think you're aware of, the plan to create a pilot of a community-led response to mental health crises. That group has been developed, they've been identified, and they've been meeting. So some of the funding is going towards that pilot and that process that they've pulled together, and that will go into FY23. So I think that's a part of it.
And part of what I'm trying to understand is, because I know a lot of community advocates who are very committed and interested in that design process, but then are trying to understand, are you guys holding some of this money for the actual implementation of something? Because I think nobody wants us to get to a place where the design pilot's finished in October, November, and then it's kind of like, well, we're just going to pause on this for 7 months because there's no money in this operating budget to do anything. So that's kind of part of the thrust of the question.
Right, and I think that's an important question that's still under some discussion. Largely, it's because some of the money was, was related to what EMS will be doing in terms of their sort of co-responder response, which is what you discussed. And I think how much of the money will go towards EMS is still under discussion. EMS will be here this afternoon, and we can talk more about that then. But I do hear your concern, like how much of that money will actually go to a pilot. And that is money that probably should be carved out of that 1.75. That money is just being transferred to us now, so there is some, movement and discussion, ongoing work to decide exactly how best to utilize it, but I completely hear your concern.
So I think I would say, and this would be a request through the chair, I think that the council needs to understand how that money's being split between these strands, like prior to budget authorization. Like, I think we need a little more clarity than we've got right now on that lump sum. And so just, that would be a follow-up that I'd love to do. Appreciating everything being in motion here. And then I wondered if you could talk to me a little bit about the sort of real estate portfolio of the BPHC. So kind of two related questions. So one is, it seems like from what I've heard that we're paying a pretty considerable lease at 85 Bragdon. And, you know, where I think we have both EMS Special Operations and then the Office of Emergency Management, which isn't under you guys, but I think covers that lease out of their budget. And my impression from city workers is that that facility leaves a lot to be desired, and also that we're paying quite a lot for it. So I'm trying to understand sort of like, how have we ended up there? Have we thought about using our own real estate portfolio to better house some of our stuff? Are we thinking about siting? I know that siting's been a continuous challenge for EMS, thinking about headquarters, et cetera. And then sort of slightly separate question, you know, we're doing a citywide audit of city-owned land and opportunities. To what extent is BPHC participating in that, you know, and thinking about, you know, other city needs like housing, et cetera, that, you know, there might be room in your real estate portfolio for, so.
Yeah, I can answer both those questions. On Bragdon Street, I'll defer it a little bit to Chief Hooley on sort of any long-term plans that he has for that space. I don't know if you've been out there, Councilor. I mean, obviously it's a large garage that they have. They have tons of stuff in there. They've been using it for many years. It is an expensive lease. I believe it's around $30,000 or $32,000 per month. With that lease is in place through FY24 with a planned potential option on EMS's side to extend it for 2 additional years. Yeah, I don't know what the long-term plans are. I think it would be a combination between discussions between Boston EMS, the Health Commission, and the city if they want to try and site that in some other area. I know EMS built that other sort of smaller facility out in Mattapan a few years ago, but that's for kind of a different reason. So I think Chief Hooley may have some other thoughts about, you know, a longer-term plan for that, but I agree. I mean, it's an expensive piece of property. It is. And it does have some, as far as, you know, the maintenance of it goes, recently they've had a few issues with it, but for the most part, it's, you know, it serves its purpose. But I'll turn it over to Chief Hooley for this afternoon for more thoughts on that. And then just as far as the audit of our BPHC's property, we have been working with the city. They did reach out to us just over the last month to make sure they have a full and complete list of all of the property that BPHC owns and operates. We've given them that full lease, everything from, you know, Northampton Square area, Mattapan, Long Island, just to continue those discussions about whatever we have that we can provide around, you know, additional housing down the road. So we've given them that full and updated list just within the last few weeks.
And just for my understanding, where in the BPHC apparatus does property, like the sort of strategic property stuff live?
Sure. Property is one of the departments under administration and finance. We have our own property division of, I think it's probably 15 employees who really help us maintain all of our BPHC-owned property, but then for any of our capital improvements, we work with, you know, the city to handle those larger structural issues.
Great. Thanks so much, Madam Chair. Thank you.
Thank you. Council Baker, you have the floor.
Thank you, Madam Chair. Tim, just quick, not to belabor while we were just talking about property in Northampton. So, who's the company that took that over and did the units there? So they were supposed
Trinity. Trinity Finance.
Trinity, right. They did the units over there. Those are all done, I assume. But then there was plans for, I thought, the Northampton garage, and they were going to build something there on the south end. So did that relationship end after the housing units were rehabbed? Are they still going into the rest of that building there?
Yeah, they still own those, the high rise and the low rise.
Yeah.
And then they did have that other plan to build that third tower, kind of near the corner of Albany.
Yeah, in Northampton.
And Northampton Street. That plan didn't move forward. I think the construction.
Well, wasn't there a rehab plan for the whole building and that first floor and everything? If we're looking for space, if we're choked for space.
I recall that their plan was for that larger kind of building. And
Yeah,
that would
so
take up that entire
we own that
complex.
still
land.
now,
Yep.
and there's no real plan for it yet?
There haven't been any discussions around that
Okay.
sort of third tower over the last several years.
So that's all that Trinity is interested in now are they still trying to get that tower built?
They haven't raised that with us over the
Yeah.
last several years at
Do
all.
they still have an option with it? Because, how long have you been here? Have you been with
I was in
ANF
the
for,
General Counsel's office for 12 years prior to this.
yeah,
position.
with public health?
Correct.
So you remember the deal?
I do,
Yeah,
yeah.
okay. Well, we could probably spend,
Yeah, if need be, I can provide more
yeah.
information around that.
So
transaction.
we've got a $7 million increase. Is that basically all the employees here that we're looking at, 41 new employees with the EMS? Is that the lion's share of the $7 million increase?
Yeah, the lion's share is the FTEs plus the fringe on top of that.
Yeah, that's not ARPA money?
No,
Are
this
you
is
using any ARPA money for this increase here?
That's a city appropriation.
City
new investment
appropriation.
request.
Yeah. I forgot to say good morning. Doctor, good morning, and good morning. I just jumped
Good
right
morning to
into it. Sorry about that. I apologize. So it has, where the proposed new investments are, 4 full-time employees to staff the co-response. So is that the road we're going down, the response with mental health care professionals with EMS? Is it really gonna be comprehensive? Are we looking at police co-response? Are we looking at, or is it going to be an EMS response? Do you have a sense of that?
So are you referring to the 4 new FTEs?
Yeah,
New investments?
yeah, I'm on the proposed new
Right.
investments.
So that's not related to what we just discussed, the 1.75 piece. Let me explain. So the 4 FTEs will be working
Yeah, but
within the center.
I'm talking about maybe the way we're looking at
Oh.
responses.
Sure.
So that to me, so you're gonna have best clinicians with EMS. And is that gonna come in on a 911 call and based on the language on the call, that will be appropriate with EMS and a best clinician?
So maybe let me just go back to, those 4 FTEs are really intended to staff this Center for Behavioral Health and Wellness. Some of the work that they will be doing will obviously be about, co-response,
Yeah.
crises, how do you manage that? And there'll be work with EMS, to coordinate our efforts so that we're not working in silos. That's kind of what we plan to do within the center. It is, sort of separate from the 1.75 that we're talking about,
Yeah.
the community-led design and the co-response and the alternative response and this sort of work there. But all this will be coordinated. I think that's the point, is that all of it will be coordinated.
So, okay, I'm gonna move on. I'm gonna move on from that. I wanna do the, and I'm a little confused because you're calling it a center, but it's not like, so when I hear center, I think, okay, we're gonna go here and we're gonna talk to our, you're saying center, but meaning more of an online support center. So the initiative isn't center like I have in my head. It's more of a coordinated effort and it's a,
So the term center, and I probably should have explained this, I apologize for that. Really, it's just meaning to encompass all the multidisciplinary, diverse, comprehensive, holistic work that we do both at the commission and outside across city departments and communities. So it really is just an umbrella term. So it's a
Yeah.
place where people coordinate, they collaborate, they do lots of different things. They may include some type of call center, they may include lots of different things, but it's a general term. Almost like we have with our bureaus, there's a bureau, they do lots of stuff in the bureau, similar to that.
yeah. I mean, I think we probably could have a brick and mortar center someplace. Tim, how much did public health get in ARPA dollars? Like, did the city actually, this is all dedicated to public health, then it came to you guys, and then you spent it the way you saw fit?
Yeah, in the first round, we received 15.7 million in ARPA funds.
In the first round, so your cut has been 15, in where would you say you used that 15.7 million? Did you have to backfill anything from, because you're not really looking at lost revenues at all?
Yeah, I'll see if I can find it. The full description of our ARPA funds that are in the materials that we submitted. But it's 15.7. There's a whole different, there's a number of different lines, vaccination, testing, PPE.
Yeah.
There's some for recovery services. There's some for community health, CIB, 1.5 million. But it's 15.7 million that we've received so far, and that funding, the MOU that we have with the city runs through December of 2024, so we have until then to spend.
So would that include money that went to the Roundhouse and to the Envision Hotel and places like that, or that's separate?
No, it's separate.
Okay,
That is separate.
okay, so would that be D&D dollars?
That's
or?
D&D dollars.
Okay, we talked a lot about behavioral health and mental health issues and seniors and veterans and a lot of response. And a plug that I'm gonna put in now is, what are we doing sort of proactively? What are we doing to make sure kids in particular have someplace to go that's healthy for them, that they know there's food there, they know they have a safe space to do their homework at, they know they can play basketball, play gym, hockey, whatever. And this is the point in the discussion where I plug the field house over at Columbia Point that's proposed. We had a hearing on it, and I think it should really be looked at really be looked at in terms of what it can do to prevent mental health issues for young kids now. Well, and not just young kids, for people, like something for people to do, a gathering spot, a center. You know, and I'm asking the city for a little bit of investment. You know, out of ARPA dollars, we've gotten almost $1 billion. And I think that, I'm glad we're talking about the response and the, you know, I have mental health issues in my family. I think everybody does, and we all just lived through this last 2.5 years. But I think the opportunity that we're missing, and see, I'm getting a little on the other side of life, and I look for that center to go walk into, to go see somebody. Like, I don't want to go on the phone anymore. I don't want to get on the computer. I think we need to start, even though we're online, everything's online, we did 2 years of Zoom, I think we need to start looking at what we're doing to build infrastructure for generations to come. So if you could, look at, I'll send you the hearing. It's the proposal for the field house. It's the way that we involve the community, the kids over there. It's at Columbia Point, which is was designated as an opportunity zone. It's been, you know, when Columbia Point first happened, it was in the 50s. They built 5,000 apartments, put it in the middle of nowhere, and there was a dump at the end of the street. Now that dump happens to be worth money, but a lot of the issues are still there. There's not much over there now. So I think that we, as the city, should try to build as many things. We were talking yesterday with BCYF, and it's been, I think, 5 years working on where we're gonna site a community center in Dorchester someplace. It was a request that I had 6 or 7 years ago for a feasibility study. We're 5, 6, 7 years into still talking about where should it go. This is an opportunity to build this thing in the next couple of years. You know, and we just found out at the McCormick, sorry, I'm getting a little off public health here. We just found out the McCormick, they're gonna stuff high school kids into the McCormick. There was a plan to do an addition over there so they could fit there. The plan's still to put the high school students in the middle school building. It's disastrous. So my frustration here is showing through, and you know, you guys have done good work through the pandemic, but I think the pandemic's work isn't done. I think we've got, I think Councilor Murphy said it, 10 years of extreme behaviors, people not being able to deal with their own emotions, and I think that we as a city should play a part to try and build healthy spaces, especially with all this money that we have around. So thank you. Thank you, Madam Chair.
Thank you, Councilor Baker. A good segue into my line of questions. When we're talking about social determinants of health and the issues that perpetuate systemic racism in the city of Boston, we have to look at program in a way that, as you say, that builds centers, whether figuratively or actual facilities that addresses these issues, so that we can have this ecosystem with this umbrella of services that works in synergy with community, government services, right, home, all around, and makes sense. So a little bit about, about 2 years ago, when the city of Boston declared racism as a public health crisis, we had, basically, we had all of this language designated to what that is and what was happening and why children from densely populated areas or disenfranchised communities were suffering, or why we die from gun violence, or all of this as we know it, and as your beautiful report on your website states, is due to their social determinants of health. What I've noticed with the city is that a lot of our services are reactionary and not preventative. And this is just sort of the way that we have acclimated or adjusted to surviving. Understanding a thing and then to respond to it when a community gets loud enough about it, or when a community has access and understands how to navigate resources, or empowered enough to be able to advocate for themselves. And so I guess I want to know, in particularly, what exactly or what programs have been designated to, I guess, curb or begin to work on racism as a public health crisis. Are there any implementations of dashboards or metrics to actually monitor your progress? Has there been a treatment plan for racism since it's a public health crisis? And if so, how do we monitor it? If we monitor it, what metrics do you use to measure progress?
So I think that that's a great question, and certainly something that I myself have, thought a lot about and wanted to emphasize in my, role at the commission. So a number of things have happened since racism was declared a public health crisis. I spoke in segments about, different aspects of it. One of the things I think is important has been this focus on data, because if you don't know exactly where the problem is, it really is difficult for us to target it. And we have been making a lot of generalizations in terms of what happens for this group of people or that group of people. So we have developed a new demographic data collection tool, which I have to say is, sort of still in progress. It's still something that is being implemented. The tool is being piloted with the Mayor's Healthline clientele, and I think that evaluation is going to be important because it is how you actually see who people are, and I do think that is a critical piece of what's already been asked here multiple times. Another example that I would give is our agency-wide language access plan, which I think is incredibly important. We have implemented policy strategy around the fact that people have to have access to services in multiple languages.
Tell me about the data part. What exactly are you collecting, and what programs are you collecting it in?
Right, so there are multiple different data that's being collected. So in the data collection tool that I mentioned, I don't have it open right in front of me, but certainly it is about race, ethnicity, but also country of origin. It really is drilling down to exactly where people live. And beyond that, getting a better sense of exactly what their experiences are, not just, housing. So what is it about your housing? What are the characteristics of your housing? Because that is part of what we're talking about when we're talking about structural racism. It's not just saying if people are sheltered or unsheltered. how good is the housing that you're actually living in, and what is it that we can do to improve that. So I can provide you with the actual data collection tool.
Are we doing that for all of Boston, or are we doing that with certain departments?
This is a demographic data collection tool that was piloted within the Mayor's Health Line. So this is, the Mayor's Health Line, as I think I mentioned, has, thousands of calls per day, so that's a lot of people. But the goal here is to get a better sense of who is of need in Boston. And it was very disturbing during the COVID-19 pandemic when you actually looked at that data and we couldn't even quantify the racial and ethnic disparities. You probably remember, people were like, oh, it's this, oh, it's that. And actually here in Boston, we actually did a pretty good job. I mean, even I wasn't at the commission at the time, but we had 99% of race ethnicity data for the folks who were suffering. So I think that's actually good, but we need more than just race and ethnicity. We need to really understand who people are. So that's one piece. The other piece is this health equity precision dashboard that we're developing. So Councilor Flynn mentioned the health equity textbook that people take a look at. This dashboard will actually be exactly what you're talking about, so that anybody can take a look at, okay, so what metrics are we using to measure diabetes at X census tract or at X sort of level, here in Boston? What is it that's happened over time? Has it gotten worse? Has it gotten better? Because we don't have that information. We make some generalizations. I think we, get a general sense of what's happening, but I think having a precision dashboard is important, and we have a group that's working internally as well as externally, as well as with City Hall, trying to create this dashboard.
So there's a health line, then there's a group internally and externally that's working on it. What's the overall plan of implementation aside from these two things that you mentioned?
So there's also the Boston Health Equity Measure Set. I just want to make sure that we have a number of different streams that we're working on. What I would gather is within FY23, we will have these things implemented. A lot of these things have taken time to get up and running and are sort of in progress. But I do believe that this data is going to be available and accessible to Boston residents
Once you
next
have
year.
the data based on the people that we serve, then let's talk a little bit about the people that do the work. And so in terms of your demographics, and part of the reason why racism is a public health crisis is because we internally need to lead by example as well. And so your demographics for your top 10 paid is 60% white. Of that, of those 6 people, that's the top 60%. 4 are male and 2 female, and then 2 female that are black, and one Hispanic or Latino, as you have it listed. 1 male Asian person, and so. Do you, that obviously doesn't represent the demographics of Boston, and that's sort of the pattern across the board throughout Boston, except this is a little tiny bit better.
But I gotta say, this is much better than it was last year, 2 years ago. I wasn't here, and neither was my deputy, and neither were some of these other folks. So things have gotten, I have to say, that things have gotten better. And I think
I should preface this by saying that I'm not interested in embarrassing anyone, not the mayor, not the administration, not myself, not you, the panelists, not my colleagues. I'm not interested in playing the blame game. I would like to talk about the facts as they are and talk about where we need to go. And I just wanted to say that because I think it's counterintuitive, counterproductive for us to even say why is it this way and just be angry about it. This is not personal, this is just sort of the pattern that we have and we're working on. I appreciate the progress, and but I want to go on record in making sure that the people at home understand that we do still have a long way to go. And where we are exactly on accuracy, on the numbers. And so then when I look at and then I don't want to go through the numbers right now, but when we look at the employees as well, and beyond the data that you gave me, we had BU look into the numbers as well. It's still, there's a huge disparity in terms of pay by race and demographics, and it does not, again, represent the population of Boston. And so therefore, we're not leading by example, although we're making, small changes, big changes, because we have you now, but still, right, a lot of work to do. So I think that what I'm saying is I'm connecting it. the people that we serve is one thing, and that happens a lot with like, okay, so Boston is majority Black and Latino, but then the teachers are majority white, and then on top of that, they get paid more than their Black counterparts. So it's across the board, and that's the systemic racism that we talk about, and perpetuating the clients, the issues that the clients that we serve suffer, because then the people that we employ can't feed or take care of their children adequately, and we're doing that as a city. We're also part of that problem. I think in terms of the data, that's super important. And then I guess I wonder about your different departments. And you have like this amazing report assessment that you've done in terms of why racism is a public health crisis. But then when you look at the different departments, so like I went through Recovery Services Bureau, Child, Adolescent, Family Health Bureau, Community Initiatives Bureau, Emergency, Homeless, Infectious Disease, and then we go down to Public Health Service Center, Administration, Property, right? And out of those departments or different bureaus, we don't see actual like department or intention or center or system to tackle racism as a public health crisis. And I think that's where, in my opinion, I think that's where we need to move into, because when I look at, for example, state of emergency for communities of color, and then I see that it's only $100,000, you know what I mean? And we can have conversations about like, what does that cover? But obviously, there's not a real intentional, like, one department that's aggressively transforming this problem. And it's great that we are tackling, you know, recovery services. It's great that child and adolescent, of course, that deserves money and more. But I wonder if something is a public health crisis, and we know that systemically, Black and brown people died 30 years sooner in Roxbury than Back Bay. How are we intentionally building that up? Where's the program, right? And that's just the conversation that I want us to begin to go into, because we can talk numbers all we want, and I would agree that you need more money even. In terms of the BEST team, why only, did you mention 4 clinicians?
No, I wanted to be clear about that.
Okay.
We weren't talking about the BEST team. It's the 4 FTEs that have been requested for the Center for Behavioral Health and Wellness.
Oh, I see.
We wanted to give you, we were going to follow up with you to provide you the number of clinicians with the BEST team.
Okay, thank you. And so the 4 FTEs, they're doing the outreach and, sorry, can you repeat
So
what
the
they
4
do?
FTEs would be allocated to this Center for Behavioral Health and Wellness at the Boston Public Health Commission, and one of them is going to be a Chief Behavioral Health Officer. So they're going to be leading, spearheading a lot of the work that we're doing across city departments to meet this unmet need that we described in terms of mental and behavioral health. The other 3 FTEs would be program management. So there are a number of different areas that we've talked about, you know, whether it's youth mental health challenge prevention or public health response to addiction, dealing with a lot of the issues across the age span in terms of mental health needs. These would be program management roles that we hope to fill.
Okay, thank you. I have more questions, but I think I should probably go back to my colleagues for second round, and then hopefully get to my other questions after. And in the same order, Councilor Liu-Jen, you have the floor.
Thank you, Madam Chair. I just want to go on record sort of like really supporting everything that you just said, because I think that is, especially, you know, the times that we're living in right now, addressing something as a public health crisis and responding to it, I think probably requires some ingenuity. And I think that we're capable of that, the ingenuity that's involved in really attacking, really thinking about what are we programmatically doing to address this beast as an issue. And so I appreciate that line of question. I also appreciate Councilor Baker talking about, you know, and even though I'm a millennial on my phone, very online, I think people do sometimes want a center to walk into, if they're experiencing mental health problems, if they need somewhere to go. So I just want to uplift that. I guess a question that I had was about the community initiatives. If you could provide us with a list of, this is also a formal request via the chair, of nonprofit organizations that receive funding via BPHC, I think that would be great, because sometimes even we can sometimes sniff out some of that structural racism and bias even in our grant-making capacity. So if we could get a list of those nonprofits, that would be great. It also seems that the community initiatives have a high administrative cost based on the budget book. I'm not sure if there's a reason behind that, or if that's, it looks like, let me pull it up, that there's just a really high admin cost, not just for the Community Initiatives Bureau, but for a lot of the other ones. So what really is behind that?
So I don't have that in front of me.
Yeah, I'm not sure.
It's from our budget book.
Yeah, I'm not sure. I have that answer right now, Counselor, but I can get that to you.
Thanks. So I guess there are three formal requests that I've put in via the chair. One was about partnerships with respect to ORC, Office of Returning Citizens. The second is the list of nonprofits that have received grants, let's say over the past, let's capture the pandemic, so prior to the pandemic, over the last 3 years. And then three, reasoning behind some of the high administrative costs in some of the bureaus that we see in the outline of the budget for the BPHC this year. Thank you. Those are all my questions, Madam Chair.
Thank you. Councilor Bach, you have the floor.
Aren't I after Councilor Breen? Are you? Sorry.
Councilor Braden, I think you have magic powers and somehow you disappear sometimes. Councilor Braden, you have the floor.
Madam Chair, and thank you all. This is a great conversation and very important to have. Boston is this incredible city. We have huge resources, academic medical centers, schools of public health. Do we have a strategy to try and bring all these resources to bear in addressing racism and partnering with all of the different entities across the city to really, really, really attack this crisis of racism and public health, or that racism is a public health crisis? I often say, I scratch my head and go, why do we not have the best public school system in the country, given all the same this sort of resources we have? And again, it's back down to a question of looking at systemic racism. So do we have any strategies to try and bring to bear all these resources? And I know you work closely with Boston Medical Center, because that's part of the history, the institutional history, but there are so many other resources still out there.
So I think that's a great question. We actually work beyond Boston Medical Center with the schools of public health, so Boston University School of Public Health and Harvard School of Public Health. And we've been talking to them about what we talked about with the Boston Health Equity Measures set, which is really important, even that, we're collecting data, but we're also thinking of strategies to address the inequities that we see. So a lot of the systemic issues that you're talking about, born of structural racism. We're actually having a meeting with them. It's going to be, I believe it's spring 2023, so it will be held at HSPH, but it will involve academic centers as well as community folks from around the city. So you're right on target with exactly what needs to happen in terms of bringing people together to talk about these critical issues.
And then the other issue I want to bring up really is the whole issue of food access or food. People use the term food apartheid at this point in time. We have, even in our district, we see a pattern of the places where we have food deserts in Alston, Brighton. We have a large population of low-income seniors and folks with disability who live across the street from a Whole Foods that they can't afford to pay, that they can't afford to shop in. And really, are we working with other city entities and quasi-public entities like BPDA to evaluate access to food? We're asking for a district-wide master plan for Alston Brighton, and you know, we're not just thinking about the size and height of buildings and what's the best and best possible, most profitable use of the land. We want to talk about public health and food access and how far is it to your nearest doctor's office and all of those things, and access to good public transit as part of the whole mix. Are you working with BPDA and other groups to try and push that conversation?
I think that that's incredibly important. I know HS, now HS, was doing work in their food access program in that regard. What I would say to that is that we are doing a lot in terms of collecting data. Our community health needs assessment is asking people more about this, so we have a better sense of exactly what's going on in our communities, as well as what the actual strategies will be to address them. So I can say in terms of data collection, we're getting more information. In terms of working directly with other organizations, we need to do more of that and collaborate across city departments.
And then the other question I had was really about just your communication strategy. We have a really diverse, and it's not probably, we have a lot of diversity in our neighbourhoods, and different neighbourhoods have different mixes of diversity. And just in terms of, do you have a strategy to improve access to the diverse populations in regard to language access and just digital access as well, in terms of having information, having your website be more accessible and more user-friendly for folks who might not be very tech-savvy?
Absolutely. So a number of programs are working in that regard. We have an agency-wide language access plan, which incorporates the needs, the ability to have people who speak, I believe, 9 different languages available. And I think we have an overview of how many people at the Boston Public Health Commission actually have a second language, and coming up with ways, going to speak to some of the systemic issues of how do we pay them more for their skill set, because that I think is really important. The second thing is that we have a grant through the Office of Minority Health that's paying for collaborations with diverse communities, specifically looking at issues of language access, that's run through IDB. So it is focused in on COVID, but it's also focused on everything else beyond COVID. I was going to mention one other language program that we have, but we're working, definitely working in this area.
Yeah, you know, one thing I want to avoid is throwing the ball to BPHC and just saying, here, go fix this. There's a lot of community resources out there. I know when COVID hit and we were trying to do a vaccine clinic at the Jackson Man Community Centre, you folks, you give us the materials, we got it translated into Arabic, Portuguese, Russian languages. You know, there's a lot of community and neighbourhood groups that are ready and willing to partner, and it's just trying to be better connected to the grassroots and help that outreach process. And we're all in this together, and we can all solve it together. So rather than putting all the pressure on you folks, but really encouraging you to tap into all the community resources that are already on the ground working in neighbourhoods.
No, I really appreciate that. And I would also, what I was going to say is that I think tapping into grassroots, actually working with diverse media outlets has been one of the ways that we've spread the word in regards to not just COVID, but other, obviously chronic diseases and other problems that we know exist. We have a new relationship with El Planeta to work with them to do podcasts about various different health issues. Definitely high on our priority list.
Very good. And once again, thank you for all your great work. I think you're doing a fabulous job. And
thank you.
Any which way we can be of help, please let us know.
We definitely appreciate it, and I'll pass that on to the staff who are working really hard.
Thank you. Thank you, Madam Chair.
Thank you, Councilor Braden. Councilor Bach, you have the floor.
Thank you so much, Madam Chair. I was wondering, could you speak a little bit to, I know on the CARES Act and like FEMA reimbursement side, I think especially on FEMA reimbursement, I think even more has come to BPHC than to the city, sort of where are we on that in terms of collecting, in terms of our expectations, Yeah,
FEMA has supported us with sort of millions of dollars over the last several years. CARES Act as well. CARES Act ended at the end of December, and FEMA is 100% reimbursement still through, I believe it's July 1 of this year. That actually may have got extended till September. So the numbers that I have right now are that BPHC has sort of allocated to FEMA. It's upwards of $46 million over the last 2.5 years. And that's a long reimbursement process. We have our finance office, Steve Simmons is our chief financial officer. He runs weekly meetings with a sort of team of BPHC folks. We also have Guidehouse, which is an outside vendor that the city also uses to assist us with all of the FEMA reimbursements. But that process will probably take a little, another year or so for us to see if we're going to get all of that money back. It's just a long process that has to go through, not just to the federal government, but even Congress for some of those larger requests for reimbursement. But the process is ongoing.
And how do you handle that, like, from a budgeting perspective? Because, yeah, I know it's the same with us, like, right on the city side, like, we've been waiting, and it's great when you get the reimbursement, but you can't sort of predict. So then when you go back and tag things against that, does that leave you guys with sort of like a free cash component? Like, I don't know how the BPHC piece of this works.
Yeah, I mean, so we've been paying for a lot of this over the last several years, that combination of CARES, ARPA, and FEMA. It'll come initially from our fund balance to cover those costs, and then we put in for the reimbursement. We do that closely with Jim Williamson, Ellen Hatch, and Justin previously, so that they know exactly how we're doing. They'll keep an eye on what our fund balance is throughout. But yeah, as of right now, we're still waiting for that significant amount of FEMA reimbursement to come back to us, which hopefully will come back sometime over the next 9 to 12 months.
Got it. And then on the public health services, PHCSC, what?
Public Health Service Centers.
Service centers. So that's where you've got your budget growing the most. Can you just remind me which piece of the new investments is tagged to that line?
That's the new investment for the 12 FTEs
That's the 12
in the
FTEs.
Office of Public Health Preparedness.
Got it. And so there's the service centers, and then there's sort of in your guys' budget, you've got overall public health services expenditures, which is like 100. Basically, you've got like this category, it's like 124,000, the 4 million that you spent last year. I'm just trying to understand how you guys organize your budget. Is that a bureau, or are other bureaus inside of that?
I think that's just the total amount of.
That's the total. So you put break all the different bureaus down. Okay. And then circling back on this hiring challenge, which everybody's facing, I guess I just sort of wonder, because obviously the challenge for the council is like, we want you all to staff up, but if you have current vacancies that you can't fill, and then we add more positions that then sit vacant, then we're tying up a bunch of budget authority in a way that doesn't actually get used and turns into a pumpkin next June 30th. So how are you guys thinking about actually achieving the hiring on those 12 positions?
On the 12 positions that
Well, and I mean, in general, right? Like, because if we presumed the ironic thing is that if we presumed the sort of, the continuing of the challenges that the city currently faces, you could probably hire 12 new people with the current budget authority, right? Like, just in terms of like the number of positions we have sitting empty.
Well, I think it ends up being a little bit complicated because some of this is union, non-union, and then some of these openings that have increased over time are some of our lowest sort of pay grades, some of the lower level positions, and we're talking to our unions as well as our labor and employment relations leadership to get a better sense of how we change those pay grades, because that's one of the major issues is people don't want to take those low jobs, and they can't afford to do so. So we're sorting through those very complicated issues, but I hear exactly what you're saying.
Yeah, I mean, it seems like we need like a major comp and class effort citywide, right? And I think, my sense is that that's one of the things that Alex Lawrence is focused on, and presumably that you guys would partner on.
Yeah, we've been working on it for a while.
Yeah, it's just a huge challenge. Can you I don't know if this was meant to be in this afternoon's, but the workforce development piece with our homeless, I think there's like a partnership between us and St. Francis House and others to.
That's this
Is that an
afternoon.
afternoon
Yes.
question? That's fine. And then similarly, this disaster behavioral health skills piece.
Right, so that is this more, so that was part of what I was telling you
Right.
about the 12 FTEs. So disaster, behavioral health, training, community resilience.
Right.
Yeah.
And I guess what I'm just trying to understand better, and this is just a sort of layman's question, is I think as I was listening to you explain it, I didn't totally understand what the piece was that we haven't had up till now that we're achieving with these new
So I think it's
folks.
the scale. I think
Okay.
that's what it is. It's not that.
It's not
there
a
was plan.
category that we
No,
weren't serving.
There was a plan, it was a plan, and you have to, that's part of the problem, is being able to implement it and having the FTEs to implement it and have the funding to implement it. Our Office of Public Health Preparedness has been primarily grant funded. It hasn't had the amount of funding to do all the work that I outlined. So this is what we're trying to do, scale it up, because we know that public health preparedness is such a critical issue, which, I think highlighted in everybody's minds throughout the pandemic.
Of course. Yeah, absolutely. And that sits inside of this public health centers.
Right, so some of these terminologies are a little old. We're doing some restructuring, we're gonna be doing some strategic planning, and probably that term will, be changed so that we can be more clear, because I think there have been a number of questions about centers versus public health service centers. We wanna be clear about how we're organized.
Okay, great. Thank you, Madam Chair.
No problem. I'd like to just read Council Mihir's remaining questions on record. In terms of workforce development, it seems like BPHC has been more successful than other departments when it comes to hiring employees of color. How is BPHC collaborating with other departments that struggle to identify talent and qualified employees of color?
So I appreciate Councilor Mejia's comment. I think we have a long way to go, as you already stated, Councilor Anderson, and I just want to emphasize that we do have a diverse staff, but it needs work. So before I jump into what we're doing to collaborate with others, we all need to work on this. A lot of what's happening is that we have staff who are Black and Latinx out there who are representing the Boston Public Health Commission, who are at health fairs, and I think this has been not health fairs, employment fairs and whatnot. They've been doing a lot of the work for recruitment. In terms of collaborating with other city departments, we would love to do more collaboration with other departments. We have been working with them to do the job fairs, particularly recently, that have been held, and I think that's our major collaboration, but we could learn from each other. I think that's really important, and I have had conversations with other department heads to talk about, well, what is it that you guys are doing differently, and not just with diversity, equity, and inclusion, but with our anti-racism policy, which came out of the declaration. We have that internally, it was developed, and it really does focus in on issues related to procurement, to hiring, to standards, and our cultural values, our core values within our organization. This is something that the Commission has really been sort of focusing on since the declaration was issued. So I think we have a lot of things that we could share, but I also think we have a long way to go. So I appreciate that question.
Okay, thank you. Her next question is, cases of COVID are back on the rise. One of the thresholds for rescinding COVID-19 public health requirements was a community positivity rate of 5%. What is the current community positivity rate, and at what point do we consider looking at systemic public health changes to help address these concerns?
So I believe our most recent community positivity rate was 10.8%. So it's headed upward, and it likely will continue to head upward. This relates back to the slide that I showed where I had wastewater that's heading upward very steeply, which is telling us where this pandemic is going to go, cases going upwards and hospitalizations going upward. In terms of what we do about this, I mean, we know that Black, Latinx, Indigenous folks have been disproportionately impacted by COVID-19. I think everybody is well aware of this. And in order to address the disparities, the inequity. We have to dig into those, structural determinants, the social determinants of health. I think this relates to all the work that we do and that we've described, understanding that not everybody is going to get their communication from the same, sources, making it available in multiple languages, making it available through community meetings as opposed to online where people don't have access, realizing that people need exercise programs, chronic disease management, because those are the underlying predisposing factors that lead to severe illness from COVID-19. I think all of those things, that's the fundamental work that I think the Commission does and has been doing. We need to ramp it up. I think everybody, across the country knows that we need better public health infrastructure. And a lot of this is the work that I've described and I think is really important in this budget, because if we're not doing this work, we're not going to be prepared going forward as we have other surges or as we have other emergencies.
Thank you. And for the remaining of my questions, I just have a couple. Are you able to quantify, or do you have a budget for like anti-racist efforts in the past?
I'm sorry, do we have a budget for our,
Do you know how much money you've spent on anti-racist efforts or any
so
type
under the
of-
declaration, well, we can talk about what's under the declaration. Do we have the budget? I would have to look. I don't have the declaration budget in front of me.
Yeah, I mean, it's been 4 million, the declaration funding has been 4 million for FY22. It's spread around 3 different sort of groups. Under research and evaluation, there's $1 million that's under our CAF Bureau, and then there's, I don't remember the specific number, but it's under our racial equity office as well. So over the last year, those 3 offices have done, a number of different things under all of those different buckets. Under research and evaluation, a lot of the declaration funding has been used for our BHEMS work. There's a lot of that funding also goes to our hospitals and health centers who help us with the data collection for the BHEMS work. Under the Office of Racial Equity, they're doing 2 RFPs currently around sort of health equity projects. And then under the CAF Bureau, they have, of that $1 million funding, there's around 900 of it that's been, 900,000 that's been encumbered so far with a number of subcontracts and amendments to the NTT groups that they work with. So to give you a better, an answer, I can give you a sort of a spreadsheet that'll cover all of the specific funding and the line items that we've had for the declaration funding for this year. But that's kind of it in a nutshell for FY22.
In the RFI questions that were submitted, we asked about procurements. Any record of contracts that you have? And you'd have to excuse me, I think I've said this to you before, so English is actually my 4th language. And although it sounds like I've been here forever, and I have been, communication is a communication. If I'm not clear, let me know, because your face tells me a lot, Dr. Ojikutu. And so I want to know, where is the list for your contracts, if you haven't one? Okay. And then a breakdown of demographics and where they're coming from, their location for those contractors or vendors.
For all of BPHC?
Yes, please.
Okay, yeah. Within our materials, we did submit a list of basically all of the contracts that we have for FY22. I don't believe we broke it down by, exactly where they are in the city. And then there's a second list in the materials that we submitted that have our CUBE vendors, our certified underrepresented business entities, and it lists all of those as well.
Yeah, I apologize. I can't seem to locate it, and if it's there, maybe it's because I usually identify it by that column that has like the location, and since if it's not like that, maybe I just don't recognize it, but I don't see it in the report. I'm looking at it right now. So if you can submit that, and then obviously, give us the list of all the MBEs that within that list. That'd be helpful. And again, I agree with you, Dr. Ojikutu, that that data is super important. And so looking at this information carefully. Unfortunately, the budget season is not set up for much success in equity because everyone is in the rush to get these hearings, right? And it's really not fair for us to have the conversation of change while the budget season is going on. And it's supposed to be a numbers thing, but everything is relevant. So these questions, of course, and I hope to continue to work with Bphc to see in terms of how we can come back and maybe getting a full, more extensive report prior or after budget season in a way that is more intentional and us carefully analyzing what is going on in terms of programs and how to implement services in a way that is equitable. And I think that I've expressed this before, I really appreciate your work and what you do for the city of Boston. And so far, you've come in, you're a trailblazer, and you are brilliant, and we love you, and we appreciate your work, and we look forward to continuing to work with you. Council Braden is, I love that you're still here, Council Braden. We have just one person on Zoom. Is she still with us? Yes. And let's hear her testimony, and then and then you could take your time and keep them here for 2 hours. They're not going anywhere. Yep. We could just stay here through. Yeah, just have food running. Right. Thank you. Ms. Radwin, I think it's always a pleasure to have you with us. Can you hear me? Lori?
Yes, ma'am. Can you hear me?
Yes, welcome back. It's always a pleasure having you. Please state your name and affiliation and address if you want to, and start your testimony.
Sure. So my name is Lori Radwin, and I live in Rosendale. And I'm going to go way back to Dr. Ojikutu's opening statement. I want to commend Dr. Ojikutu and the Commission for your response to COVID. And I particularly want to thank you for the COVID dashboard. I've been able to follow these data to plot my own, my family, my friends, my loved ones' course of action to stay safe. I'm also a seasoned health service researcher, and I know quality when I see it. And we are in Boston are getting truly high quality care in this regard. I also want to thank you for calling out nurses. We appreciate this recognition. I listened carefully when you talked about your attention to your employees, and I appreciate it. Here's a concern, and I have communicated this concern to my counselors and also, I believe, to you, Dr. Ojikutu. I'm very concerned about the quality of COVID treatments, particularly in hospital. And I've circulated an evidence-based paper about how the distribution of ECMO, the treatment of last resort, may not be distributed justly. And I also have concerns about treatments such as the monoclonal antibodies and antivirals. How are they being distributed? As I said, I've discussed these concerns, and I would like to suggest an initiative, adding to your great to-do list, to do a retrospective and prospective analysis to assure that each resident has an equal chance of receiving scarce treatments. And this analysis that I've suggested does not rely very heavily on primary data collection. You have data from the state, as I understand, and other sources of data that you can get from hospitals. And, you know, we're talking about health equity, we're talking about racism as a health emergency, and this probably is one component that relates to deaths within hospital for people with COVID. Thank you.
Thank you so much, Ms. Lori. See you soon.
Good.
Thank you. Did you want to respond?
Well, I would just respond by saying thank you, Lori, for bringing up this important point. I don't think there's been enough work in regards to equity in treatment, both in hospital and outside of hospital. We have been working with some collaborators at the Brigham specifically, but just academia in general, to get a better sense of who is actually prescribing the antivirals particularly, and who has had access to them and what are the challenges. And there is a concern, and we definitely would love to collaborate with you to talk beyond the oral antivirals, the monoclonal antibodies, and other more advanced treatments to, get a better sense of what's happening in terms of equity.
Thank you, Dr. Kutu. Councilor Braden, you have the floor.
Thank you, Madam Chair, and I'm hanging in there for one last question. COVID has taken all of our attention this last few years, but the other big public health crisis that's looming is the impact of climate change and extreme weather events. And I'm just wondering, in terms of your strategies, I know heat island effect is a killer when we have a long, prolonged heat wave. Chicago, we hear of cities in Europe and places where hundreds of people die in a heat emergency. And then the other question of, emergent diseases and mosquito-borne diseases because of the changes in our climate. Where are we on preparing for that?
That's a great question. So I was actually just looking up some of the documents that I have. So our Office of Public Health Preparedness is working very closely with OEM on developing emergency strategies across all of these emergencies that we're talking about, specifically looking at climate emergencies. So we have a winter emergency plan, a heat emergency plan, and a lot of these discussions are ongoing. I think we have a group meeting scheduled for next week to discuss more, because obviously we're hitting some high temperatures, and a lot of people are going to suffer if we don't figure out what to do in terms of the cooling centers. My understanding is that a lot of people haven't used them in the past, that maybe they're not what people want exactly. So understanding what people want, as well as what the resources are, and understanding what the evidence base is for in terms of services that should be provided. So we're on that in terms of the work of the Office of Public Health Preparedness.
Yeah, and it strikes me that when you think about the hierarchy of needs, and then the social determinants of health, and then thinking about all the things that the city does in terms of trying to meet resident needs and support the well-being of our residents. Thinking about an intersectionality with all our different departments, and thinking about cooling and heating centres, and our urban tree canopy, and access to green space and parks. It all ties together. So, sort of thinking cross-disciplinary and really working with other city departments to try and bring a public health lens to all of these questions would be really helpful. I know we tend to silo all our different departments, and we don't all necessarily talk to each other, but I think given the challenges of COVID demonstrated that we could all work together in incredible ways. So I'm hopeful that we can bring that sort of mindset of cross-departmental cooperation to addressing all the other challenges we have, especially thinking about climate change and resiliency across the city.
Absolutely.
Thank you, Madam Chair. That's all I've got.
Okay, thank you, Councilor Braden. Thank you so much for bearing with us, and we'll see you this afternoon. I think it's also important to state, to be clear, that social determinants of health is not all public health. It's also, it encompasses so much more that you are obviously not in control of, but hopefully in that spirit that we move, as we're moving toward creating these ecosystems and collaborations with community and working with public housing and education and so forth. I think I had just one question, and it was about sort of the mental health or behavior health. If you have a resource, or if there's a place where there's some sort of hub for all clinicians.
I think that would be great to create. I do know of several portals specifically for clinicians of color in order to access services. I can send that to you.
Okay.
I can actually email that to you right now.
Great, thank you. And then, I did file something to look at nonprofits that are working together in this sort of synergy of wraparound services.
That's great.
To get supports from the city. Children's Services of Roxbury being one of them, right? And they are, they're working with me in connecting to, in District 7, in connecting to the art corridor and how that we create space, environments that it's more therapeutic and conducive to mental health or just public health in general. And I think that it'd be nice to hear from you in that hearing in the future, in understanding how we can, again, connect to the
Happy
city and create that level of collaboration. Thank you so much. Unless you have any comments, we'll adjourn. All right, meeting adjourned. Thank you.
Thank you.